Picture this, you have just landed in your dream destination. The sun is hitting different, the culture is electric, and everything feels possible. Then it happens, a twisted ankle on cobblestones, a sudden fever that won't quit, or maybe you simply run out of the medication you depend on every single day. And you have absolutely no idea what to do next because nobody told you healthcare abroad could be this complicated. That right there is exactly why we are having this conversation today. Welcome back to the channel. If you are planning to live, work, or retire in another country, one of the most critical things you need to figure out before you pack a single bag is your international health coverage. Not just for emergencies, but for the everyday stuff, and especially for any ongoing prescriptions you are currently taking. Because here's the thing most people never think to ask until it is too late. Will your medications even be available in your new country? We are going to break all of this down today so you walk away with real clarity. Let's start with the foundation. International health plans are not the same as travel insurance. I want you to really let that sink in. Travel insurance is designed for short trips and covers sudden emergencies. International health plans are built for people who are actually relocating and living abroad long term. These plans wrap around your life in a foreign country and provide coverage that functions more like the health insurance you would have at home. That distinction matters enormously when you are thinking about things like routine checkups, dental visits, or managing a chronic condition. Now let's talk about emergencies first, because this is where most people start their thinking. Emergency coverage is non-negotiable. If you are living overseas and you experience a serious accident or sudden illness, you need to know that you can walk into a hospital and receive treatment without facing a financial catastrophe. Many countries have excellent public healthcare systems, but as a foreign resident or expat, you may not automatically qualify for those benefits. International health plans fill that gap and ensure you are not left scrambling in your most vulnerable moment. But here's where it gets interesting. Emergency coverage is really only half the story. What about the routine care side of life? We are talking about your annual physicals, blood pressure checks, cholesterol monitoring, skin evaluations, women's health visits, all the standard maintenance your body needs. A lot of people moving abroad completely overlook this piece because they are so focused on the dramatic what ifs. But the truth is, the routine stuff is what keeps you well and catches problems early. A solid international health plan should cover both sides of this equation, not just the crisis moments. Now we arrive at the piece that can genuinely derail someone's entire plan to live abroad. Prescriptions. This is where things get real and where I see so many people completely underprepared. Your medications might not exist by the same name in another country. The brand name you have been taking for years could be unknown overseas. In some countries, specific drugs require different documentation, longer waiting periods, or are simply not approved for use at all. Some controlled medications face strict import regulations that can make bringing a supply with you across borders legally complicated. So what do you actually do about this? Several things. First, talk to your doctor well before your move and get a detailed letter describing your medical conditions and the medications you take, including the generic names and dosages. Generic names are universal even when brand names are not. Second, research whether your specific medications are available in your destination country. Contact a local pharmacy, connect with expat communities online in that country, or reach out to a local doctor there before you arrive. Third, check your international health plan to understand exactly how they handle prescription coverage abroad because not all plans are created equal on this front. Some international health plans offer prescription benefits that work globally, reimbursing you for medications purchased locally regardless of country. Others have networks or preferred pharmacies in specific regions. Knowing this ahead of time is not just helpful, it could be life-changing if you depend on daily medication to function. Let's also address something that ties all of this together. Continuity of care. When you move to a new country, you are essentially starting over with the healthcare system there. You lose your doctors, your established medical records access, and your local pharmacy relationships. The best international health plans account for this by offering telehealth options, helping you connect with specialists, and sometimes even providing concierge medical support services that help you navigate the local system. Do not overlook these features when you are comparing plans. They represent real value when you are in an unfamiliar healthcare environment. Here is a question you need to answer honestly before you commit to any international health plan. What is your actual health situation right now? Are you young and generally healthy with no medications? Your needs look very different from someone managing diabetes, heart conditions, or mental health treatment. Be honest with yourself and be honest on your applications, because misrepresenting your health status on an international health insurance application can result in denied claims exactly when you need coverage most. Pre-existing conditions are handled differently across various international health plans. Some exclude them entirely, some cover them after a waiting period, and some premium plans include them with full coverage. Shopping around and reading the fine print on this specific point is absolutely worth your time investment. Living abroad is one of the most rewarding experiences a person can choose. The freedom, the growth, the adventure of it is genuinely extraordinary. But that life has to be built on a foundation of smart decisions, and your healthcare coverage is one of the most important pillars of that foundation. Getting the right international health plan means you are protecting not just your health, but your entire vision for what life abroad is supposed to look like. Do not let a gap in coverage or an unplanned prescription crisis pull you back from the life you have worked hard to build. Take the time now, do the research, ask the hard questions, and get the coverage that gives you genuine peace of mind. If this video helped you today, hit that like button, subscribe so you do not miss what is coming next, and drop your questions in the comments below. See you in the next one.